An academic study released on March 16 by researchers from Imperial College London provided a sobering assessment of how the global coronavirus pandemic could affect the United States and United Kingdom. If the virus were allowed to spread essentially unchecked, the researchers found, some 2 million Americans might die. Introducing some efforts to slow the virus's spread could push that total down to 1 million. Deborah Birx, coronavirus response coordinator for the White House, was asked about the study during a news briefing the following day. "I think, models are models. And they're based on input, and they're based on infectiousness without any controls," she replied. "I can tell you we've never seen that level of infections that modeled up to that 2 million in mortality." At that same news briefing, President Trump and the task force announced a 2-week period during which Americans would be asked to focus on social distancing and slowing the spread of the virus. By the end of that 2-week period, it was clear that more needed to be done. So, on March 31, the White House announced that it was extending its recommendation that Americans stay at home for another month. In defense of that announcement, Birx pointed to data from a group of researchers, including from Imperial College London, detailing how high the toll could have been and where the administration hoped it would land instead. In their estimates, she said, they had between 1.5 million and 2 million people in the United States succumbing to this virus without mitigation. Yet, through their detailed studies and showing us what social distancing would do, what would happen if people stayed home, what would happen if people were careful every day to wash their hands and worry about touching their faces, that what an extraordinary thing this could be if every American followed these. And it takes us to that stippled mountain that's much lower, a hill, actually, down to 100,000 to 200,000 deaths, which is still way too much. From a political perspective, it was clear what the White House was doing. The number of cases and deaths was starting to climb, so the administration, justifiably, sought to remind Americans how bad things could have been. On more than a dozen occasions in one briefing, Trump pointed to those potential millions of deaths as not only a worst-case scenario but as evidence of how well his administration had done in containing the virus. What Trump really hoped for, clearly, was that the number of deaths would land well below even the lower end of the less deadly scenario range. For weeks, Trump insisted that the country would not see many more deaths than it had already suffered. On April 10, as he was beginning to push for scaling back the restrictions aimed at limiting that death toll, he said the country was headed to a number substantially below the 100,000.